Hey everyone, welcome to week 2 of our Men's Health Month celebration with the topic covered knee arthritis. So first question up is, what is it? Okay, I got a good model of our knee here. So knee arthritis is when we have some degenerative changes in our knee. So here's our depiction of our knee. We have our femur into our tibia. Okay, here's the medial aspect and the lateral aspect, okay, because we can get arthritic changes here in the medial and the lateral. We can also get it in our patellofemoral joint, which should be up in here. So our patella is our kneecap, so our knee glides on our femur, we can get some arthritis in there. So that's where it can be, but what is it exactly? So there's really three things that we think of with arthritis. One is the cartilage changes, right? So one, we have our big meniscus here, right? We can get some wearing and tearing on that. More importantly, we have a fine film of cartilage actually on the surface of the bone itself that can degenerate, okay, and cause some inflammation. So those are kind of the two big things we think of with knee arthritis, but it's kind of more complex than that. We also get an inflammatory process which causes in both the knee itself and then in the synovium, which is the cartilage that surrounds our knee joint. So it's not depicted here, but around our whole joint there's a fibrocartilage that helps keep fluid in the joint, which helps lubricate it, and that can become inflamed. And the third thing is we can actually get changes in our bone itself, in our subchondral bone. So where our bone meets, turns into the subchondral aspect here at the joint, we can actually get some softening up in that bone. So those are kind of the three things we think about with knee arthritis. The next question is a fun one, and the question is, well, what can cause it? And this is fun because I get to kind of debunk some common myths that I hear in the clinic of what people think actually lead to or cause arthritis. So the first one we'll talk about is playing sports. So right now there's no research-based link showing that playing a sport actually leads to arthritis, and I hear that one quite a bit. But what we do know is an injury during sport can lead to it, such as a meniscus tear or ligament tear, vice versa. Okay, and along these lines, the next one that I hear a lot is running. Right, a lot of people think that running will lead to arthritis, increase arthritis risk down the road, and that simply is not the case. There's actually a recent research study that looked at cartilage density in individuals who were former marathon runners compared to those who were not, and they found that their cartilage was denser in marathon runners. Like I alluded to earlier, that cartilage is what, the degeneration of that cartilage is what leads to arthritis. So they have thicker cartilage, which means that they would have less risk for arthritis. This can be kind of counterintuitive for a lot of people to think about, because a lot of us think about our body being like a vehicle, right? And with our joints being our suspension in our car. In our vehicles, you know, you only have a certain amount of mileage that you can put on your suspension before you have to take it in and replace it. But the one thing that our body is missing, or our body has that our vehicles is missing, is adaptability. Our bodies are incredibly adaptable to stresses that we give it throughout our lifetime, and make the appropriate accommodations for that. The other things that can lead to it are obesity, so increased body weight, which makes sense, and I think this is part of why we are seeing increased arthritis in our country, is because the obesity rate in our population has started to drastically increase as well. And another, the last one that can lead to it is metabolic stress disorders. I won't get into specifics there, but any sort of immune response can lead to that as well. Okay, question number 3 is another fun one for me, and here it is. My doctor said I have knee arthritis and my knee is bone on bone. Does that mean I need surgery? And the short answer is no, not necessarily. So here we'll depict what really bone on bone is, and I'll talk about it with the medial aspect of the knee, because that's by far the most common place for that to be bone on bone. So what they're talking about here is we have this normal joint space and the thickness of that. So as our medial meniscus degenerates, that joint will approximate. So there's gonna be less space in there, but we still probably have some sort of cartilage on the actual femur itself that's giving us a little bit of support. And like I talked about before, the more important thing is where is the arthritis? Do we have arthritis just in that medial aspect where it's bone on bone, or do we also have it in the patellofemoral or the lateral part of our knee as well? If it's just in that medial aspect, you can do really well with physical therapy. doing some strengthening and flexibility work of both the knee, the ankle, and the hip to support it, and work on that more control of the knee and opening of that space. But the other side I'll throw out there is just because you have physical therapy doesn't mean surgery is not an option. If you have surgery, conservative therapy is no longer an option. So you can always give physical therapy a try for 3 or 4 weeks, and if you see improvements, great, we can avoid surgery. But if physical therapy doesn't help at all, you can always have surgery afterwards, after giving it a try. And ultimately, what I've seen is people that try physical therapy first actually are better off in the post-op care anyways, because they built some strength and some flexibility that's easier to gain after the surgery. Okay, the next question we have is, what can I do when I have an acute flare-up of knee arthritis? And the simple question, or the answer to that question, is to move. And now this can seem kind of counterintuitive because it can hurt to move, or we can be fearful of moving, like we're going to make it worse. But we actually know that movement or physical activity on our joints will actually stimulate our cartilage cells to secrete a protein of which suppresses the inflammatory response. Like I kind of stated earlier, that inflammation is what causes a lot of our pain with arthritis. So if we can move and decrease this inflammation, it can really help alleviate that. We also know that with movement, our body will secrete a synovial fluid within our joint, which is a natural lubricator to our joint. And so think of like WD-40 on a rusty joint at home. You spray it in there, move it around a little bit, starts freeing that joint up. And that's the same thing for our joints within our body. We can't use WD-40, but that synovial fluid that's secreted within our body is the natural lubricant to our joints there. So now a lot of people ask, well, what if walking hurts? Then do something unweighted. Get on a bike, an elliptical, a pool, more importantly, if you have access to that. Just anything we can do to move to help with that. I also wanted to talk about some modifiable risk factors when it comes to arthritis today, and the big one with that is weight. We know that 1 kilogram increase or excess of weight, which is 2.2 pounds, gives us a 10% increased risk for arthritis. And also we know that when someone with arthritis, if they can reduce their weight by 10%, they will decrease their symptoms or their pain within their joints by over 50%. So weight loss is huge. Weight for that. So not only to prevent arthritis, but also to alleviate some of the symptoms when we have arthritis.